Are you suffering with an arthritic knee and you're trying to decide whether or not a total knee replacement would be a good idea? If you are, then hopefully this video will be perfect for you. If you don't know who I am, my name is Harlow and I'm the Over-Fifties specialist physio here at HT Physio in Farnham. And today I'm going to be revealing my 6 knee replacement signs that I look for in my clients when trying to decide whether to refer them on for an orthopedic opinion. Now, total knee replacements are an operation that can be done for people with severe knee arthritis, but the problem is we have to make sure this person has exhausted all of their options first before getting a total knee replacement. Now, the last thing people want to do is get a knee replacement too early. So there are 6 signs that I look for that can indicate that this person might not respond well to physio and they might benefit from a total knee replacement instead. Now, before I dive into the 6 tips, it's important to note that this decision is totally individual for everyone. Some people will have a total knee replacement earlier and that will be fine. Some people will wait a lot longer, but these 6 points are just things that I look for that might be clues as to whether a total knee replacement is a good idea. It's not to be taken as gospel. Hopefully it will just help you make your decision. So the first sign I look for when considering whether to send someone on is knee giving way despite strengthening. Now, as a physiotherapist, one of the first things we do when we see people with knee arthritis is we try and make the muscles around the knee stronger. So we'll give exercises to strengthen the quads and the glutes, and people with knee arthritis who are suffering with their knee giving way, if they do those exercises many times, the giving way stops. But if someone has tried all of those exercises, the knee feels stronger when we test it, but they're still getting that horrible giving way symptom when they walk around, that can be a sign that the arthritis is just too bad within the knee and a joint replacement might be a better option. The second knee replacement sign I look for is pain at rest. Now, for most people with knee arthritis, their pain is there when they're up on their feet and they're walking around, but when they sit down and they rest, after a few minutes, the pain just starts to ease. And that's a really good thing. That means that it's mechanical pain. But sometimes when knee arthritis gets to a certain point of severity, these people can start to get pain just when they're sitting down. And that means that the arthritis may well have progressed on to a more severe point, and this can be another indicator that a total knee replacement is a good idea. The third knee replacement sign I look for is a person being unable to walk more than 200 yards without assistance. Now, when we're talking about assistance, what we really mean is either the help of someone else or the help of a walking aid, which is not what they normally use. So if this person is used to walking around without any aids, and then suddenly they can't walk more than 200 yards without a stick or without a crutch, this could be a sign that a knee replacement is needed. Now, the caveat to this is that many people who have knee arthritis come in to see me unable to walk very far, and with proper rehab we can get them walking. So all of these have the proviso that the person has tried physio and it's not worked very well. But if you've tried physio and you still can't walk more than 200 yards without assistance, that's a sign that a total knee replacement might be a good idea. The fourth knee replacement sign I look for is being unable to be active without painkillers. Now, many of my clients come in and they tell me, I hate taking painkillers, I'm coming to see you because I want to get off them, and I help people do that all the time. But sometimes, no matter what we do, the person is still relying on painkillers to get through their day, and that can be a sign that the knee arthritis has progressed to a severe point. So if you're popping lots and lots of painkillers just to get through your day, it could be a sign that a knee replacement is worth considering. The fifth knee replacement sign I look for is night pain. So if your knee is keeping you awake at night and you've tried putting a pillow under your knee, or you've tried lying on your side with a pillow between your knees, and none of this is helping, you're still waking up 2, 3, 4 times per night, this can be a sign that it's time for an operation. And the reason this is a sign is because if you go for a prolonged period of time with very disturbed sleep, that can have a wider impact on your health. So I would see this as a priority problem to be solved. So if you're being kept awake all hours of the night because of your knee, it might be worth speaking to an orthopedist. And then the 6th knee replacement sign I look for is visible deformity. Now, visible deformity, what I really mean is an angulation of the knee where it's either buckling inwards, which we call valgus, or buckling outwards, which we call varus. Now, some people just have this naturally. They might have had it for many years, in which case we say it's probably okay. But if it's developed over the previous couple of weeks or months and it feels like it's getting worse, then that could be putting undue stress on the knee, and no matter how much physio you do, it's not going to relieve the pain. So if you've noticed your knee changing shape quite rapidly over the last few months, then that can be another sign that a knee replacement is worth considering. So I hope that video has been useful. As I said before, these signs are not to be taken as gospel. They're just designed to give you an idea as to whether it's worth seeking a specialist opinion. The good news is many people who have knee replacements report a really good outcome. The vast majority of my patients who've had one are pleased that they've had one in the end. But if you have a bad knee, it's always worth trying everything else before you go through with surgery. So try physio, try everything else you can before you go under the knife. Anyway, I hope that video has been useful. If it has, please like the video, subscribe to the channel and leave a comment below. And if you want to get more from me, you can pick up a copy of my book. It's called Thriving Beyond 50 and you can find it on Amazon using the link below. Thank you so much for watching and I look forward to speaking to you on the next video.